Several epidemiological studies have analysed associations between dietary factors and fibroid development. Women who consume the greater amounts of vegetables, fruits and dairy products appear to have a decreased risk of developing fibroids, whereas women who consume more beef, ham or other red meat may have an increased risk of developing the fibroids. Glycemic index is a measure of food's ability to increase the blood sugar compared to a carbohydrate such as glucose or white bread. Glycemic load is a measure arrived at by multiplying the glycemic index of a serving of food by the grams of carbohydrate that it contains. An analysis of 21,000 African American women reported those with the higher dietary glycemic index or glycemic load have a slightly increased risk of developing fibroids. Additional analysis found African American women under the age of 35 with a high glycemic load also had an increased risk of uterine fibroids. Women who exercise appear to have a reduced risk of developing fibroids. A dose-response pattern is apparent, such that the women who exercise 7 hours or more per week reduce their risk more than the women who only exercise 2 hours or less. The effect of the exercise on the fibroid growth might be due to the loss of body fat. Studies have shown the women who exercise and reduce their body fat by more than 2% have reduced levels of sex hormones, testosterone, estrone and estradiol. And the exercise also reduces levels of insulin and insulin growth factors. These combined effects can decrease a woman's risk of developing uterine fibroids. Epigalloglycatechin gallate, or EGCG, is a polyphenol and it's found in green tea. It has antioxidant, anti-inflammatory, and anti-tumorigenic properties, and it shows significant promise for the treatment of uterine fibroids. A randomized placebo-controlled trial showed the effects of 800 mg of green tea extract containing 45% EGCG per day in 39 women with symptomatic fibroids. The 22 women who took the green tea extract for 4 months daily had a significant 32% reduction in the fibroid volume and a significant 32% reduction in the severity of the fibroid symptoms. The green tea extract also led to significant improvements in anemia, blood loss and quality of life. There were no reported adverse events following the treatment. The EGCG also inhibited the growth of new blood vessels that supply malignant tumours with nutrients in the lab and animal models of cancer. It inhibited the growth of uterine fibroid cells, and it induced uterine fibroid cell death in a lab study. Additionally, the EGCG significantly reduced the size and the number of fibroids in an animal model. The combination of EGCG with vitamin D and a small amount of vitamin B6 has also been studied in 2 clinical trials. Vitamin B6 has been extensively studied and it's shown to be of benefit in the management of premenstrual syndrome. In the first pilot study, 30 women of reproductive age with at least one fibroid of greater than 2 cm³ were randomized to a treatment with a combination of 5 mg vitamin B6, 25 micrograms or 1,000 international units of vitamin D, and 150 mg of EGCG taken twice a day for 4 months or no treatment. At 4 months, there was a significant 34% reduction of fibroid volume in the intervention group versus a 6.9% increase in the control group. Questionnaires assessing the quality of life and the symptom severity revealed significant improvements in the intervention group versus the control. In the second, larger trial, 95 women with at least one fibroid of greater than 4 centimeters in diameter received either the same intervention or no treatment for 4 months. After 4 months, the total fibroid volume decreased by about 38% in the intervention group versus 5.5% increase in the control group. In addition, a score relating to the health status and the quality of life significantly improved in the intervention group. Several studies have reported women who have lower serum levels of vitamin D are more likely to develop uterine fibroids. In one study, there was also a significant relationship between vitamin D levels and fibroid size. Women with lower vitamin D levels had larger fibroids, and those with higher vitamin D levels had smaller fibroids. This finding was especially evident among black women, and it was also present as a trend in white women. Another study found women with sufficient vitamin D levels, defined as greater than 20 nanograms per milliliter, had an estimated 32% lower odds of having fibroids, compared to those with vitamin D levels below 20 nanograms per milliliter. Another study reported women with vitamin D deficiency had a significant 2.4-fold greater odds of having uterine fibroids. The majority of fibroids have low levels of the vitamin D receptor compared to the surrounding normal tissue. Vitamin D decreases levels of proteins known to contribute to fibroid formation, and it inhibits the replication of fibroid cells. In a lab study, the active form of vitamin D at normal concentrations significantly inhibited the growth of uterine fibroid cells by 12% compared to the controls. This effect was stronger at higher concentrations. The greatest concentration of activated vitamin D significantly suppressed the growth by 62%. A preclinical experiment found a treatment of mice with vitamin D at a dose equivalent to 124 international units per day for a 175-pound woman significantly reduced the fibroid size. The data suggests the vitamin D can potentially be effective for treating fibroids, and it suggested people try to maintain a level of the 25-hydroxy vitamin D between 50 and 80 nanograms per milliliter for optimal health. 2 clinical trials have assessed the effects of vitamin D as a monotherapy on uterine fibroids. In a sample of 108 vitamin D insufficient women who had less than 30 nanograms per milliliter, and they were diagnosed with small burden fibroids, the participants were offered supplementation with 50,000 international units of vitamin D once per week for 8 weeks, followed by maintenance therapy of 2,000 international units daily for a year. Those who refused the therapy or who were non-compliant were considered the control group. The fibroid characteristics and symptoms, as well as the vitamin D levels, were evaluated 12 months after the initial diagnosis. In the intervention group, in addition to a statistically significant increase in the vitamin D level, there was a lower rate of surgical or medical treatment due to the fibroid progression, and there was no change in the size of the fibroids in the vitamin D group versus a significant increase in the control subjects. In a randomized clinical trial that included 60 women with uterine fibroids with vitamin D insufficiency of less than 30 nanograms per milliliter, oral supplementation with 50,000 international units of vitamin D weekly for 12 weeks did not significantly reduce the fibroid volume. However, there was a significant increase in fibroid volume in the placebo group, suggesting vitamin D may have played a role in preventing the fibroid growth. Vitamin D levels in the intervention group increased from a baseline of about 11 nanograms per milliliter to about 31 nanograms per milliliter during the intervention period. It's unknown if achieving higher vitamin D levels would have provided a further benefit, because in both of the studies, women in the vitamin D group barely exceeded the insufficiency threshold, and it suggested that they maintain a level of between 50 and 80 nanograms per milliliter for optimal health. Curcumin has been investigated as a potential therapeutic agent for uterine fibroids. In a lab setting, curcumin inhibited uterine fibroid cell growth, and curcumin also decreased the level of fibronectin, an important component of the extracellular matrix that contributes to fibroid progression, without significant effects on normal uterine muscle tissue. Several growth factors are known to be important contributors to fibroid growth, including IGFs, fibroblast growth factors, and transforming growth factors. Curcumin has been shown to inhibit the secretion of IGF-1 in breast cancer cells, to block fibroblast growth factor 2 induced blood vessel growth, and to inhibit transforming growth factor beta signaling in a variety of cells, including the liver and the kidneys. A traditional Chinese formula called cinnamon and poria has been used in China to treat a range of women's symptoms since the 3rd century AD. Although it's named cinnamon and poria, it's actually a combination of 5 herbs. The cinnamon and poria formula is commonly administered as a capsule, tablet, or a liquid herbal extract. Numerous studies have analysed the effects of the formula on fibroids and their associated symptoms. A comprehensive review of 38 randomised controlled trials with a total of 3,816 patients reported the formula was more effective at reducing fibroids than medication alone. These results support those reached in separate analysis that analysed the cumulative evidence from 7 trials. That analysis found the cinnamon and poria formula, either alone or in combination with prescription drugs, also appeared to significantly improve the symptoms of painful periods. Treatment with the cinnamon and poria formula posed minimal risks, and no serious side effects were reported in any of the trials. Black cohosh is a herb that's commonly used to treat menopausal symptoms. A 2014 trial assessed the effects of 40 milligrams of black cohosh extract in 34 women with menopausal symptoms and fibroids. In this trial, a different group of 28 women took the synthetic estrogen, tibolone, a drug that's not approved in the US. In 70% of the women in the black cohosh group, the fibroids decreased in size an average of 30% after 12 weeks of treatment. In the tibolone group, the fibroid size increased by 4% during the same period. The thunder god vine is an extract of a Chinese herb and is frequently used in China to treat uterine fibroids. Several clinical trials have shown that it significantly reduced fibroid volume and heavy menstrual bleeding after 3 to 4 months of treatment. A 2005 paper reported on a study of 124 women, half of whom received 40 milligrams of the extract daily for 3 to 6 months, while the other half received a prescription drug. The authors reported a significant decrease in the fibroid size after 3 to 4 months, with a more pronounced effect detectable by 5 to 6 months. This was based on ultrasound examination. In a similar 3-month trial comparing the herb to the prescription drug in 62 women, the authors reported a significant reduction in the fibroid size. In both these trials, the results of the herbal extract were superior to those achieved by the drug. An earlier trial showed the extract had significantly decreased fibroid size after 3 to 4 months of treatment, with a somewhat higher percentage of patients responding after 5 to 6 months. The decrease in fibroid size with the treatment was time dependent, and the response was nearly double after 5 to 6 months when compared to 3 to 4 months. It's worth noting 38% of the patients did not have a menstrual cycle during the treatment. The treatment also decreased estradiol and progesterone levels. Despite the promising findings, several reports of severe toxicity and even death are associated with the use of the herb when it's taken above the effective dose. And the effective dose appears to be very close to the clinically required dose. Therefore, this herb would not be recommended without being supervised by a professional. For more information on herbs, supplements, and natural treatment plans, check out my website.